We crossed our reporter Siphephile Kunene, who is in Elukwatini in Mpumalanga. Very good afternoon to you, Siphephile. Lots of babies expected to be born today. Tell us more.
Yes, Mpumalanga as a province got 42 babies and they're expecting more as the day advances. And there's a lot of issues around a baby delivery. They have to go through labor and all those. But right now here we will talk to safety issues as well as the mortality rate that has been recorded as 0 in this hospital. With me here is Mzwandile, who represents workers. Mzwandile, in terms of working and your safety in hospitals, I understand a few weeks back you were up in arms against the government in terms of safety. How has that panned out?
Yeah, of course, we've been having the challenge of safety across the province, but here today we're here at Mpumalanga. I must say that in other areas we've seen improvement in terms of the implementation of the resolutions that we've agreed with the Premier, which includes Witbank Hospital, Rob Ferreira and other areas. But here today we've seen some gaps and we've talked to the management here. The MEC is here. We've agreed that there should be implementation of the plans. Not long we'll come back again for review.
In terms of the workload and in terms of the availability of emergency workers, how was yesterday? How did they carry out yesterday, since it was New Year's Eve? People get to hurt each other. There's emergencies time and again. How did you deliver as workers at this hospital?
I must say that it's a festive season. As it is, it's busy. So we've been very busy the whole night. We've been running up and down. We've collected 8 patients in Blood Plus Clinic, Mayflower. They're very busy, these 2 facilities. So I must say that we've been very busy, and of course, as workers, we're short-staffed. If you look, we've got 4 intermediate. We don't have any advanced life support here, and we think that the department must assist us by employing more. I want to appeal to the MEC to open the college for the EMS people there at Elijah Mango, because we know that there's a person who's on a post of a principal that is employed but is not there. So we want that college to be reopened so that at least we're able to train the EMS people. And of course, then that would deal with the issue of shortage.
Okay, let's go back a bit to the issue of safety. One of the measures that was implemented was that private cars should be parked outside, and it has served you, it has helped you in terms of creating safety in hospitals as workers, but it sort of disadvantages those ill and vulnerable that are those that are bringing in the ill and vulnerable. What's your take on that as workers?
In terms of the resolution, we have agreed that on special considerations, they would then be able to take those people in, be assisted, and then the cars would then go back outside and park outside. So that's what is happening currently.
Thank you so much. That was Mzwandile representing employees at Mpumalanga Hospital. Now we are going to be talking to the Department of Home Affairs. They are here. They say they want to establish offices in all hospitals nationally so that they can register children at birth. Jale here will tell us more about that. The aim of you having these offices in these hospitals.
Yes, thank you very much. We've joined the MEC of Health in Mpumalanga today as part of Home Affairs endeavors. As you know, the Department of Home Affairs embarked on a modernization program starting in 2013. Part of the modernization program is to ensure that we provide efficient services to clients of Home Affairs in the different channels. So one of the part of the program is to ensure that babies are registered as they are given birth at hospitals. So part of that would be to ensure that you set up processes, offices that would be able to register birth as they happen live here in the hospitals. However, even now, as we do not have the processes here in the hospitals, our staff members do come to hospitals, collect the information and register the birth at the Department of Home Affairs, nearest Department of Home Affairs office.
What does a mother need to bring as she comes to hospital to to give birth so as to be able to register?
Yes, that's a very important question. Thank you. The emphasis is to ensure that mothers understand that they do need to bring their smart ID, their identity documents when they come to give birth. And also just to emphasize that mothers do need to register birth within 30 days from the date of birth.
There's also this issue of unabridged birth certificates whereby you need the dead and their particulars so as to register. Say the father is not here. The last time the mother saw him was when she got pregnant. What happens in that case?
Yeah, the birth is registered even. Remember, with unabridged birth certificates, there is a category or a space for the mother's details as well as the father's details. If the father is not there, the mother is still able to register the birth and have the birth certificate issued.
Thank you so much for your time. This is a drive to make sure that babies are registered within 30 days after they are born. And if you are a mother that needs to register a child, you don't need the dad around. If he's not around, you can still bring your own particulars and make sure that your child is properly registered and is already in the Home Affairs system so that you don't give them problems when they have to go to school, when they have to go to college, when they have to travel, and when they have to receive other services from government. With me now here as the MEC for the Department of Health in the province. You have 42 babies in the province that were delivered. You have recorded 0 mortality rate of babies here. What's the secret?
I can say that as a department, we are very happy that we do have some pocket of excellency in the province, especially when it comes to maternal mortality. Last week, we were at Shongwe, we're 2.5. So indeed, we are doing well. And it's because of the program that is put in place to make sure that mothers do visit the clinic as early as possible so that we can check in terms of making sure that they are healthy and they regularly do their checkups. So we are very happy that even other provinces can come here to the province and benchmark on the good work that we are doing. However, we need to give credit to our health workers in the province because without them, we cannot record such excellency in the province. So they are working very hard to make sure that even the awareness campaign that we are doing as a province so that mothers do know that what is it that is expected from them as early as possible for them to be able to record and be checked and be in a good condition before they give birth.
Let's move on to the safety issue now. Residents in other places are complaining that they are supposed to park outside and move into the hospital by foot. What's the plan around that?
We must make sure that we prioritize the safety of the workers and also of the patients. You will remember that there were some incidents in the province, and the Honorable Premier convened an urgent meeting with organized labor so that we find a amicable solution to make sure that there's safety. Hence, we've started implementing that program. But of course, we're not saying if you can't walk, you can still put the patient in a car, drop the patient and go back. But what we are saying is that you can't park inside our facilities. And it is working because I'm receiving calls of people saying, hey, MEC, I'm here in this facility, they can't allow me to go in. I'm saying, yes, we are implementing the safety measures. And also, there were certain things that we've agreed with the Honorable Premier, and we've started to implement. And our people are happy. And of course, we will always request the members of the community, the municipality, to assist us because if you look at the incident that has been happening, it's people who are fighting from the community to the facility. So I think also looking at the festive season, we can say we have done fairly well because there were no many incidents in the province, of which we want to thank our people also because when we talk to them, they respond positively. So as a province, we are happy that we are here today, it's a new year, and we are looking forward to a good year with our communities.
Thank you so much, MEC. That was MEC for safety. That was MEC for health in the province, Sasekani Manzini, explaining that the measures that they are putting in place are giving positive results, both for patients as well as their workers. Back to you, studio.
Thanks, Siphephile.